Welcome to the Appleton Area Health Podcast. We're your home for exceptional service and trusted care, located in Appleton, Minnesota. Your community, your healthcare. I'm Matt Tollefson, the Development Manager at Appleton Area Health. I've been here for 2 years and have served as a grant writer, fundraiser, recruiter, and now a podcaster. I have no background in healthcare. Nobody in my immediate family worked in healthcare, and I didn't study it. And I'm kind of queasy about needles still. I've learned a lot in the past 2 years, but there is still way more that I don't already know or fully understand. That's why we are creating this podcast. Let's get questions answered, and together, let's demystify this complicated world of healthcare and make it a bit easier to understand. We are in for an interesting show for you today. I'm joined by Melissa Schwendemann to discuss Medicare, annual wellness visits, and chronic care management. We're going to visit with patient Mitch Fett and our January Employee of the Month, Saige Ochsendorf. So let's dive into today's episode. Right, joined now by Melissa Schwendemann, who's here to talk today about annual wellness visits and chronic care management. Melissa, how are you doing today?
I'm doing great.
Good. So just kind of start out a little bit. Tell us a little bit about yourself. Who are you and what's your role in the clinic?
I'm Melissa Schwendemann. I've been a nurse for a little over 25 years now. I work in the clinic. I still work on the floor once in a while. I also do the chronic care management program. I also do most of the COVID injections, lining all that up and getting all the material we need for that. I also do Medicare annual wellnesses. I get them prepped for the providers and make sure they have all the information they need for patients' appointments.
Okay, excellent. And so like we mentioned, today you're here to talk about annual wellness visits and the chronic care management. What is an annual wellness visit and who needs to have one?
An annual wellness visit is normally a patient starts usually when their Part B of Medicare kicks in. The first visit that you'll have is called Welcome to Medicare. Most people get a letter in the mail. The first visit for the Welcome to Medicare has to be done within the first 12 months. After that first 12 months, you go on to initial annual wellness. And then after that, it's called subsequential, which happens after the first 12 months.
Okay.
So with that being said, the annual wellnesses, we go over medical history, things like safety in the home, immunizations, any procedures that you need done, like colonoscopies,
Sure.
Mammograms. Make sure you have like an EKG or an echo if you're needing. Diabetics, we go through all the diabetic needs. What else can I say?
So a lot
Yes.
happens in these visits.
Yes.
Okay, good. And these visits, do you reach out to these folks, or are these folks reaching out to us to get them scheduled?
Actually, yes, I do go by month.
Okay.
We can see when the patient's been in last. It has to be to the date. So say you had it today, it would have to be a year from today or a day after. It can't be a day ahead of time. It has
Sure.
to be a year to the date.
Okay.
Yep, we usually develop a list, and then either I or the receptionist will call and get you lined up with one of our providers.
Okay. Sounds good. And when they do come in for these visits, you said you look ahead to see if they need any type of screenings or anything like that.
Correct. Yep.
And try to get those done on the same visit if possible.
Yes.
Okay.
Yep, we can. We would like to start having patients come in like a day or two before to get their labs done, so that the labs are done at their appointment, so they can go over their labs with the provider at that time.
Yep.
So
that makes sense.
yes.
Yeah.
Yep.
Okay. Well, good. What else on these annual wellness visits?
The only thing I'm just as a reminder, routine physicals are not covered by Medicare.
Mm.
I just wanted to add that to that. Things, that we kind of also go over is other providers that you see,
Mm-hmm.
like say cardiology or podiatry. We'd like to get a list of those people so that we know who, what kind of specialty providers you're seeing,
Yep.
and a current list of medications that you are on.
Okay, that makes sense.
Yep.
Yeah.
Yep.
So what's kind of the overall goal of these wellness visits?
The goal is to set up a patient plan or a prevention plan with your provider, just to keep your medical records, I would say, up to date,
Okay.
and see if there's anything we're missing. Sometimes we get so involved with our office visits that we kind of forget other things that are needed to be done just to maintain your health.
Sure. Well, that makes a lot of sense. All right. The chronic care management program then.
Yes.
Let's talk about this. What is this?
Chronic care management is a service outside the regular office hours.
Okay.
It's a non-face-to-face phone call. I usually call people within the month. Sometimes it's more of it calls too.
Okay.
But we kind of go over. I usually call and go over, say they had a change in diabetes. So then I call patient, update provider, and see if they want to make any changes without them having to come in and be seen.
Okay.
So.
Okay. That makes sense. Are there some requirements that are a part of this?
Yes. You need at least 2 chronic conditions in the last 12 months.
Mm-hmm.
You need patient consent, can be verbal or signed consent. Most of these we try to do at the annual wellness visits.
Sure.
Then we kind of make up a care plan and see what kind of goals each patient has.
Okay.
Some might need more strengthening, so they need physical therapy. There is 24/7 access to a nurse, of course, or provider with this program. What else can I add there? How you can enroll is you can get a hold of myself here at the clinic. My extension is 8571, or you can mention it to your provider and they'll, I can usually come in and talk about the program with them, or I do have an email address. It's mschwendemann at aah-mn.org. You can email me.
Okay, perfect. And as always, we'll give out the phone numbers again at the end of the episode, and have that posted if you're watching the video as well. Just if you want to talk to Melissa a little bit further about either of these programs and determine if you're eligible or not, or what your next steps are that you need to take. Melissa, any last thing to add on either program or advice for anyone listening?
I can't think of anything offhand. Like I said, I always can answer questions if you call the clinic and just ask for me, or ask your provider. I can't at this moment. Not at this moment, Matt. No.
All right. No, that's just fine. All right, Melissa, thank you for joining us today and talking about these 2 programs that are, really important to our patients. So
yes.
Thank you.
Thank you.
Joined now by Mitch Fett, Appleton resident here, just to talk about an experience that he had in the past 6 months or so with the facility. And again, we're going to revisit the calcium scoring, something that we talked about a little bit earlier with Doris Arnold. Mitch, how are you doing today?
I'm doing good today.
Good.
I'm doing a lot better than I expected to be doing. So I'm very, very satisfied with the outcome.
Okay. Walk us through what was your process? What's this timeline been like for you?
Well, one could say it all started back on March 13th, 1953.
Okay.
So without giving a specific age. But back in March of 2022, we were returning from a trip out east where my daughter lives, and had gone down to the southern states to enjoy a little warm weather before coming back here.
Mm-hmm.
And unfortunately, en route, even though we were fully vaccinated and had all the boosters and everything, my wife Devon and I also got COVID
Mm-hmm.
on the way home. And my experience with it was very dramatic as far as the respiratory side, the
Sure.
breathing and coughing and hacking and stuff, which created a situation somewhat short of breath. So that kind of led me to spending more time with my physician, Crystal Turner, at which she was looking at the possibility of there being a circulatory issue
Sure.
involved in this. So at that point, the calcium profile became part of a new arrival on the scene, and at that point it was suggested that maybe I participate in that.
Sure.
It was considered non-invasive and could give a picture of what possibilities exist. And having done that, then met with Dr. Backus, and he suggested that based upon those results, continuing the path of not being invasive, go on to a stress test.
Okay.
At which time, I believe it was September 8th, did the stress test. And I think I failed that in flying colors. And so one thing, it was obviously there was an issue. I believe the target heart rate was 125 beats per minute that you were supposed to reach, and I don't think I set a record, but I got up there in 4 minutes.
Okay.
So I was booking. At that point, then it was decided that I needed to move on to doing an angiogram.
Okay.
And so January 30th, I did the angiogram, and right prior to that, I was approached by one of the staff at the hospital, St. Cloud Central Care, and they had indicated that there was a trial program that they were doing. And for lack of a better term, call it a rotor-rooter or whatever you want to call it.
Sure.
It was just a microscopic, almost little wire device with the tiniest piece of diamond on the end of it. And
Mm-hmm.
she asked if I would be willing to participate in this program if they were able to do the stents or
Yep.
whatever, that they would involve this process as well.
Okay.
Unfortunately, and she had mentioned prior to this that she had two that had signed up for this and were unable to complete. And unfortunately, I became the third one
Oh, sure.
that day that
Mm-hmm.
could not complete. The blockage and the situation as a whole was significant enough that stents wasn't going to be the resolution, and it ultimately ended up being a four-way bypass, and we did that open heart on the 13th of February, and since then I have
So 2 weeks ago, roughly 10 days ago.
Yep, 10 days ago.
Man.
Yeah.
Wow.
So certainly glad to be back home in Appleton.
Yes, definitely.
And back in the house. So it's been quite a path, but in most cases, it would seem that the real possibility could have been had not followed these processes, which started here.
Mm-hmm.
I wouldn't be here.
Yep.
It was a ticking time bomb. So
Yeah.
it was.
Yep. So yeah, you've mentioned, Crystal and having conversations with her. Any advice for folks as they go through, having conversations with their physicians, having conversations with the specialists, all that kind of stuff that you can offer for other folks?
Well, I think, a lot of these things is you kind of realize come on very gradually.
Mm-hmm.
All of a sudden, you may realize, it wasn't all of a sudden, but I went from 160 pounds to 305 pounds.
Sure.
So, there in itself raises a flag. My AC1 or A1C was going to be a bit on the high side,
Mm-hmm.
another red flag. Blood pressure also was making its march towards the top of the chart. So those things all coupled together. And fortunately, I hadn't pushed the ball down the field to its completion, but it was through intervention here, was able to approach these issues and start making corrections.
Okay.
So I basically used up my time, and now I feel I really got a blessing with more time.
Good. Well, glad you're still with us.
Yeah, it's good to be here.
Yeah, good. So, you mentioned the calcium scoring that you did. You may have been one of the first that did the calcium scoring. So, any issues with that? Or, I know some people always talk about getting claustrophobic or that they don't like tests or anything like that. Was there any issues that you experienced with any of that?
I really didn't. It's non-invasive. The gentleman that ran me through the test was continually in communication
Mm-hmm.
in terms of where we were in the test and stuff like that. I didn't feel claustrophobic, but having been on the fire department for 20 years and doing confined rescue and that type of thing, it was something that you kind of fought through anyway.
Sure.
But no, it's a test that I wouldn't consider it any worse than taking your blood pressure.
Sure. Okay.
Yeah.
Well, good. Well, thank you, Mitch, for your story. Really appreciate it, and really glad you're here with us and that you took the steps that you needed to see the people to make the right decisions for your health. So
yeah, my pleasure. I strongly recommend that if anybody has any conceivable issues, it's a no-brainer. It's not going to be that big deal.
Sounds good. And we do, as we've mentioned before, have a few of the tests left that the Martinson Foundation has sponsored. Call the clinic, get scheduled, get in, get that done. It's the Martinson Foundation is sponsoring these exams. So, or not these exams, these preventative screenings. So please stop in, call, get it done. So thank you very much. Thanks, Mitch.
Thanks, Matt.
All right, and we're back for our third and final segment, our staff spotlight, joined by Saige Ochsendorf, our January Employee of the Month. Saige, how are you?
I'm good. How are you?
Good. So, Saige, you've been with us how long now?
I've been here since May of 2022.
All right.
Middle of May.
All right, and what do you do?
I am the executive and HR assistant here at Appleton Area Health, primarily working on HR stuff, but also help with board packets and board meetings and that kind of thing, more from the executive assistant side.
Okay, sounds good. And you're also part of our morale team here, so lots of stuff with our Shine team and things like that. All right. What about background? Didn't you kind of grow up like in healthcare a little bit, kind of the opposite of me?
Yes. So I am originally from Dawson, Minnesota. So my mom was the activity director there for about 20 years. So I grew up in healthcare, volunteered before I could work there. And then when I turned 15, I actually started working in Dawson as an activity assistant. And then I worked there all through college and then did an internship outside of healthcare, decided that healthcare was the area for me. Actually found this position, so decided that I would interview for it, got it, and I've loved it. I'm glad to be back in healthcare. It's super interesting field, and it's very, something I can vibe with very well.
Sounds good. So, for HR, like you could get a
Mhm.
job in many different places, similar to some of our other jobs, right? You kind of write your own ticket right now.
Yep.
Why Appleton and why Appleton Area Health?
The biggest piece was just that I was ready to be closer to family. So I went to school at the University of South Dakota, so in Vermilion, South Dakota. Matt's super excited about it. We always joke about a rivalry between SDSU and USD. But I happened to see the job posting on Facebook, actually. Kind of just joked with Kim about it, and then I actually ended up applying, interviewing. But yeah, just was ready to be closer to family again. Like I said, did an internship and decided that healthcare was kind of the field that I wanted to be in, especially to start my HR career. I think it helps to know the industry itself and not having to worry about that aspect of things too. So yeah, just kind of worked out, and that's kind of why I'm in Appleton.
Okay. So HR, you do your work with some of the hiring process and things like that.
Yeah.
Any advice that you would give to applicants or maybe even like a young person looking at a career in healthcare potentially?
I think just one piece of advice I'd give to a young person in general, especially if you're in college, is just to get involved. You learn so many different things about yourself when you're involved in collegiate activities, whether it's at sports or whether it's actual activities on campus. Get involved, get in a leadership role. You'll learn a lot of different things about people and that kind of thing. But I think job shadowing, getting to know the field, I think there are a lot of things about healthcare that you don't know until you've been in the field and been experiencing it. So get involved with job shadowing, like asking people about their careers, what they like, what they don't like, is probably the best piece of advice, because I think it's a lot different than what you anticipate when you first start. So that'd be kind of my biggest thing. And ask questions. I'm a huge questions person, as a lot of my new hires know. I probably ask them if they have questions about 75 times before they're done in that hour. But as an applicant, I would encourage you to ask questions if you have questions about the job at all. Definitely reach out at Chose Initiative. It's kind of my biggest things that I would recommend that they do.
Okay. Sounds good. Well, congratulations again on January Employee of the Month. Thank you for all that you do here to help all of us and keep us organized. So, yeah.
Thanks, Matt.
Saige.
Thanks for having me.
Yep. Thanks for checking out the Appleton Area Health Podcast. Thank you to Melissa, Mitch, and Saige for appearing on today's episode. The video stream is available on Facebook, and the audio versions will be available wherever you get your podcasts. To schedule an appointment, call our clinic at 320-289-1580. As we hope to spread this useful information, please like, share, and subscribe. Thanks for listening.